Welcome back at 7:15. October is Breast Cancer Awareness Month. Ongoing research and clinical trials continue bringing new medicines that are more effective and more gentle. And new technology means doctors can tailor treatment to each patient's needs and preferences. Dr. John Colfry, breast surgical oncologist from Touro, joins us this morning to explain. Doctor, good morning. Thanks so much for being with us.
Good morning. Thank you for having me.
So chemotherapy has been, if you will, the gold standard for treating breast cancer for decades now. But over the last 10 to 20 years, how has chemotherapy for breast cancer changed or evolved?
Right. I mean, chemotherapy, it used to be more of a kitchen sink approach. Throw a bunch of medicine at it and hope something works. But what's happened nowadays is we have tailored chemotherapy. What we've learned is everyone's breast cancer behaves a little bit differently, and the medicines to treat it should be tailored to the individual cancer.
And I'm sure people love to hear that when they do get that very scary diagnosis, that we're talking about you and what you need, not blanket treatment. Let's also talk about the other newer types of medicines that are available, targeted therapies, immunotherapies. When we say that, what do we mean exactly? How do those work?
The immune system is really the last frontier in medicine. I mean, it's so intricate. There's so much going on, so many new discoveries. The cancer cells actually have the ability to hide from the immune system. The immune system is there to kill cancer, believe it or not. The cancer cells can hide, so some of these new medicines will uncamouflage the cancer and help the chemotherapy and the immune system attack the cancer to kill it better.
But back to chemo, I know that's still typically the #1 option that doctors go to, I would imagine, when they're trying to treat breast cancer in their patients. I know when people hear that they have breast cancer, they often immediately are concerned about the side effects of chemotherapy. What, if anything, has changed when it comes to those side effects over the last few decades?
We have learned to pre-medicate people, so now we can give you some medicines, steroid and antihistamine, to build you up strong so that if you're knocked down a few pegs, you're back up to normal. The other thing that's become hugely important, it's called mindfulness meditation for stress reduction. We're very good at giving people the next surgery, the next pill, the next treatment, but if we're not arming them with the capability of their minds to handle the stress, it's super important. So I always try to help my patients learn about meditation. It helps treat some of the side effects, the mental racing that you get in the middle of the night that I'm not there for. We can teach you how to heal that.
And based on everything you've just said, what makes you the most hopeful about the future of breast cancer treatment? I mean, so much has changed. You mentioned mental health, mindfulness is something that's now on the table, but what about all of this makes you hopeful, or what else are you hopeful about on the frontier of breast cancer treatment?
My new favorite discovery for this year is there's a breast cancer vaccine that's in trials.
Really?
And what we've learned is there is a protein, it has a fancy name, it's called alpha-lactalbumin. It's present in women that are lactating and breastfeeding, but we've also found that it can be present in some aggressive triple-negative breast cancers. And so they're starting this vaccine on women who have been treated. Can we give them the vaccine to prevent a recurrence? So they're looking in that setting first, and then they're going to transition that into possibly preventing breast cancer.
That is fascinating. And I'm sure, again, that's just in the early stages of trials.
Early stages, clinical trials, some low numbers, some new data that's coming out about December 2025. Wow. So stay tuned.
That's incredible news, and something that good news to hear as we're talking about breast cancer during this month. But thank you so much for your time this morning, talking about the advancements in treatment and potentially prevention down the line. We appreciate your time this morning.
Thank you.